Hey guys, this is Dr. Wong with PhysioU saying hi from Beijing and bringing you a mentoring 5 minutes. So today we're talking a little bit about scoliosis. We had a patient today that Melina Loring, our orthopedic resident, we spent some time thinking through and doing our clinical exam and trying to create a program for the patient that would improve the patient's mobility. So if you think about it, the patient in actuality is a back pain with mobility deficits. So the patient came in with a curve. Here you see the convexity on the right-hand side, the concavity on the left-hand side. The rib hump was quite prominent, and there was also a very flat and hypomobile thoracic spine. So what you can see in that case is the muscles here tend to be on the short side. The muscles here tend to be longer and weaker. And then the quadratus lumborum, or the muscles on this side, would tend to then be short. And the muscles on this side, on the lower part here, would tend to be long. So when you have those pictures in your mind, the question you have to think about when we're talking about back pain with mobility deficits is, how do we attempt to improve the mobility and improve the alignment as best as we can and educate the patient to manage this problem? So this patient's already over 30. There's going to be very little progression of the problem, but posturally we want to optimize the patient and give her exercises because of this category to improve mobility. And so we're going to spend a few minutes chatting with you and having Melina chat and share a few of her thoughts, and we'll show you some of the exercises that we did that I think the patient is going to find to be very useful.
Hello, I'm Melina Loring. I'm an orthopedic resident with USC. I'm here in Beijing, and today we're talking about our 30-year-old patient who has scoliosis. And so as Dr. Wong was talking about the differences on the sides of the convex and the concave, on the thoracic and the lumbar spine, we want to be able to address those impairments. And so we were thinking of some manual therapy as well as some exercises that we can do to help this patient. So with a patient that has a convex side on the right, so you're going to see that rib hump when they do the forward bend test or the Adams test, what you want to do is, or what we talked about wanting to do, was stretching this left side as well as rotating to the left, because with a right rib hump, you're going to see a shortened side on this as well as right rotation. So that's going to push the ribs out. And so what we want to do is do a left rotation as well as a stretch to that left side. So that was one of our main goals with the thoracic spine. And then with the lumbar spine, as he said, that QL is going to be tight on the left, so we did some soft tissue mobilization as well as some stretching inside line.
On the right.
On the right, sorry. And then of course breathing is really big with these patients, so we did a lot of breathing and making sure that they can fully expand their rib cage so that she's breathing into this area as well as this area and making sure she has full lung capacity.
And by the way, our awesome patient that you'll see in a second is Faye. Faye is our awesome interpreter, and so she volunteered to be our patient for today. All right, so let's set up the patient for some intervention.
So with this exercise, what we're doing is we're trying to help de-rotate the right rotated ribs and thoracic spine. So what's causing that right rib hump is that the thoracic spine and the ribs are more up towards the right. So what we're having her do is side bend to the left, just stretch that concave section of the spine and the muscles, and then what we'll have her do is almost like a thread the needle exercise. So we'll have her reach through, which is rotating left of the ribs and the thoracic spine, getting that stretch, and then she's going to come up and do a bit of a scapular retraction too, so that's going to help mobilize the scapula over the rib cage and get a little bit of more motion in there. And then she can continue to do that. And as the therapist, you can add a little bit of overpressure here, add a little bit of stretch, she can add some breathing as well, and kind of get a whole nice combination of all those movements to help correct the curve.
Let's do that a couple times. We'll see if we do an angle.
You can also do some breathing as well, breathing in, breathing out, add a little push, stretch, and and then do a hold at the end. Really feel that stretch.
Nice.
So for this exercise, what we wanted to do was help correct the curve, especially for the thoracic spine. So we have a towel here at the apex of the thoracic spine, kind of pushing that into a more straight position. As we talked about earlier, the concave side of the spine is going to be a little bit tight with those muscles. So we're having her reach with her left arm, stretching this area of her ribs and her spine. From here, what I can do is have her take some deep breaths into my hands, and then have her breathe out, and I can do almost like a rib mobilization as well, so she can get a further stretch.
All right, guys, thanks for tuning in. And here's wishing Faye and who else? Shin is taking her exam too. All of them are taking their PT board exams on Saturday in Chinese. Can you imagine trying to do that? So wishing you the best and awesome job to Lena today. All right, guys, check it out.